Okay, so we're going to discuss about the causes of the acute mesenteric ischemia. So I have already mentioned in the previous slides that actually it's some of the pathologies in the heart which are responsible for the generation of the emboli. So there can be arterial and there can be a venous embolus. So when we talk about the arterial emboli, they're actually because of the coronary artery disease. They can be because of heart failure. They can be because of the valvular diseases, like, some of the valvular diseases like aortic regurgitation and mitral stenosis and mitral regurgitation, and some of the valve agitations like infective endocarditis and myocarditis, and there were valvular vegetations, and actually because of these vegetations they also dislodge and they cause the emboli, and they lead to the occlusion of the artery. They can be atrial fibrillation, which is most of the time involving the left atrium, and we talk about the mural thrombi in the left ventricle secondarily to the myocardial infarction. And there are some other causes like the aortic aneurysm, so atherosclerosis and atheromatous plaque in the aortic aneurysm. They can also dislodge and they can lead to the emboli generation and leading to the obstruction. You can say the occlusion. So if you talk about the thrombosis, so it can be generalized atherosclerosis. And when you talk about the mesenteric venous thrombi, so they're actually they are in a hypercoagulable states and generalized inflammatory conditions. They can be trauma, they can be sepsis, heart or the renal failure, or portal hypertension, sickle cell disease. These are the causes for the mesenteric venous thrombosis. And they can be like decompression sicknesses. So they can also lead to the development of the venous thrombosis, especially in the mesenteric vein. And when you talk about the non-occlusive mesenteric ischemia, so it's basically the low flow states, okay? So that means the patient might have a cardiogenic shock, or the cardiac output is actually low, or there can be splanchnic vasoconstriction. So remember, when you talk about the causes for the acute mesenteric ischemia, first you have to identify, or first you have to know if it's the occlusive or non-occlusive. So in occlusive, it can be arterial or it can be venous, and arterial can be secondarily to the emboli or thrombi, and venous is most of the time because of the thrombosis. And when you talk about the mesenteric arterial emboli, they are because of the left atrial fibrillation. They can be because of the coronary artery disease, heart failure, myocardial infarction, left ventricular mural thrombi, or they can be atheromatous plaques, which are disrupting in the aortic aneurysms. And when you talk about the arterial thrombosis, the generalized process of the atherosclerosis involving the coronaries or involving the abdominal aorta as well, or its branches. And when you talk about the venothrombosis, so most of the time it's because of the stasis and because of the hypercoagulable states and inflammatory conditions and trauma, heart failure, renal failure, portal hypertension, decompression sicknesses, sickle cell disease. You should remember these causes because you have to, when you are suspecting such things, you have to investigate and take a proper history. If there is a proper, there is history related to all these diseases. And then when you talk about the non-occlusive mesenteric ischemias, they're low flow states. They can be because of anemia, they can be because of cardiogenic shock, because of low cardiac output, and the other is a splanchnic vasoconstriction.